Mid-cervical rotation manipulation using a cradle hold. The operator stands just off centre. The working hand, in this case, is on the left side. The left leg is back. The vertex of the patient's head is approximately at the level of the lower abdomen umbilicus area. The helping hand is supporting on the opposite side. The patient's ear is in between the index and the finger and the thumb, and the rest of the helping hand supports the occiput. The applicator is the second metacarpophalangeal joint, the anterolateral aspect, or a more distal part of the finger, with the using of the more distal part of the finger reinforced with the middle finger. This is placed onto the articular pillar, which is just posteromedial to the transverse process. If we're working C4-5, then the applicator is placed onto the articular pillar of 4. We're going to move 4 on 5. So we introduce rotation of 4 on 5 to its maximum just gently, coming back to neutral, and then the first component is a local side bending, buckling the neck, keeping the vertex in the midline, retest the rotation, it should be less. Take away the rotation, keeping the side bending, adding a lateral translation away from the therapist, retesting the rotation, which should be smaller again. Coming off the rotation, keeping the side bending and the lateral translation. A small amount of localized extension, retest the rotation, which is a lot smaller, come back, and then introduce a compression between the hands, test the rotation to a final stop point. At this stop point, we can then give a very small impulse in the primary lever direction of rotation to release the facet. Once the joint has released, bring the head back into a neutral position to relax.